Hey guys, Dr. Ben here, Functional Medicine Center is going to talk to you today about blood work. And blood work is something that we all should be getting done. Whether you're totally healthy and feeling great or whether you've got all kinds of issues going on, you need to know what is going on inside of your body. So let's go over this today, and I'm going to show you things that today, get a hold of your doctor's office, call anybody that can get blood work, go to the cash lab, get a hold of us, whatever you need to do, you've got to start checking your blood work. This is absolutely crucial to developing the health that you want in your life. So let's get into it. What blood markers do we want to see? All right, thanks for jumping on. We get to the underlying cause of what's going on in the body, and blood work is how we do that, whether it's in our Phoenix office, Colorado office, or Tennessee office. We know that we need to look at the blood work. It's an absolutely crucial piece to this. So many people, they say, guess what? I went to the doctor and they said my blood work's totally fine. Everything's okay. One, they're not testing enough. You know, we run, if you walked in the lab, it'd be $3,000 panel. We run it for $200 because we got special cash discount. So we run a lot more, but we also have a different range. And this is a big part of what's going on. So you've seen that bell curve, and in the bell curve, you're looking at we're looking at about 90% of the population is going to fall into the reference range, the okay range. But guess what? That has nothing to do with health. What we're looking at is the narrowed healthy range where healthy people should be. And this is the optimal range that we're looking at. And so like vitamin D, 30 to 100 is a pretty typical range where we like to see it around 60 to 80. That's where the research is showing that the immune system, autoimmunity, inflammation, brain, all these different things are going to work better. So if you guys are jumping on, pop down below where you're watching from. Love to see you guys all over the country, all over the world. Give me a thumbs up if you've had blood work done lately, and then let me know if any of these markers that I'm talking about, if you've had them done, and then I can even give you a range that we like to see it in. So good to see everybody out there. Let's get into this and let you know exactly what we're looking at. So the number one best marker that I like to see is what's called ferritin. Does anybody know what ferritin is out there? It starts with Fe. Hey, Linda in Arizona. Doris, good to see you. Fe, ferritin. Ferritin is what we call the stored iron. So what does that mean? Well, we're storing our iron. There's blood iron. And Kendra, good to see you. Yes, you do not want to be fine, you want to be optimal. We've got ferritin, which is the stored iron. Blood iron, so if it just says iron, that's what's floating around your blood, but ferritin is really the one that you want to look at. And it's the stored iron in the body. Fe, just like in the periodic table, iron. I always say, if I could only do one test on every single patient, I would test them for ferritin. And people are like, come on, really? You would do ferritin tests? You think there's that many anemic people out there? Well, guess what? We run ferritin on every single person in every one of our offices. We look at it all the time. And here's the deal. Ferritin, I don't see it low that often. Maybe 5% of the people come in are actually anemic. Hey, Larnie, good to see you there in the Philippines. So here's what we look at is the ferritin, very, very uncommon do we actually see it low. Most common, I see it high. Just had a guy today, 246, had another lady today, she was over 150. We see ferritin high way more often than we see ferritin low. So the ranges are 125 in females and 150 in males. If you're over that number, I guarantee 99% of the time we see this, your triglycerides are going to be high, your C-reactive protein, which we're going to talk about, is high, your insulin is high, your liver enzymes are high. We know that there's this inflammatory condition, this blood sugar related condition that is driving this. And so our number one marker that I see when I look at my blood work is ferritin. That's the first thing that pops up. And I don't even have to look at the rest of the blood work. I've got pretty much for sure I know what this person is dealing with if that ferritin is high. So if anyone's had ferritin run, look at your blood work and pop down below what your number was, and I'll let you know where you're at. But almost every person, because here's what happens, every person this ferritin is high in, we see things, especially liver issues. The liver tells the body to store iron, and it's an inflammatory process. Hey Michelle, good to see you up there in Estes. It's this inflammatory process driven ultimately by blood sugar imbalances. And good, Doris 96, yep, in that good range. Tiffany, hemoglobin. So we don't want hemoglobin. I want to see ferritin. And Joe couldn't run high due to an infection. Not necessarily due to the infection. It's really going to be more of inflammatory related to the liver, related to the blood sugar, some of those things. So the ferritin high, everybody needs it. If you're running your blood work, you need to ask your doctor, make sure, hey, are you running my ferritin? You've got to see that. If it's over 125 in females, 150 in males, look for inflammation, look for blood sugar imbalances. This has happened all the time. Linda, ferritin of 11. This is the opposite side. So anything under 40 is going to be low. I've been diagnosed as, they figure out why. I'll get back to that one in a second, Tiana. So Linda, ferritin of 11, you are low iron. If it's under 40, you're anemic. So what's going on there? Well, odds are you're either losing blood, you're not digesting as well as you should, you're not absorbing your iron that way as well. So what do we look at? Well, very good likelihood if we're low, you've got leaky gut, you've got some type of microbiome imbalance, some type of absorption issue. We've got to look at the gut. If we're low, yes, you need to take some iron, but we've got to fix the why. So if somebody's high, inflammation, liver, blood sugar, all these different things. If somebody's low, we've got to fix the why that they are anemic. And so that's what we're going to be looking at there. So Tiana, several lab tests, was just diagnosed. I can't see the rest of that one. I'm sorry. And oops, we flip-flopped that one. Sorry, guys. I hit the wrong button. There we go. And good. So let's get back to those. Okay, so hey Paula, good to see you. So ferritin, you've got to check that ferritin. You've got to see where that level is. It's going to be a huge part of this healing process. Number 2 that you need to be testing is what is called GGT. Give me a thumbs up if any of you guys have ever had a GGT tested. You may have heard of AST or ALT. Those are liver enzymes, and so is GGT. But GGT tells us about fatty liver. And we see this all the time. Even in 20-something-year-olds, we see fatty liver. In the old days, fatty liver was from what? Drinking, right? John, that meprazole, yeah, so you weren't absorbing that iron because you were decreased stomach acid. That's why you were anemic in there. So GGT used to be from drinking. Now GGT, we will see that high because of blood sugar imbalances. We get back to that blood sugar again. Every time the blood sugar goes up too high, we store it in the liver. Every time it goes down too low, we kick it out of the liver. So people are swinging their blood sugar all the time. Blood sugar, liver, and it's doing that over and over and over, and we eventually get what we call fatty liver. GGT is the first sign of that it's coming, is that starts going up. So we've got to check that GGT. We've got to figure out if those swings are actually because of other liver issues. So if you've got high liver enzymes, and some of you out there have been told you have high liver enzymes, and hey Connie, great to see you, long time no see. Some of you have AST and ALT high, you've been told you have high liver enzymes. You have to check your GGT if you have not. If your doc is running numbers, because is it fatty liver? Well, guess what? If your GGT is normal, but your liver enzymes are high, check your lymphocytes, check your white blood cell count. It's usually a chronic viral issue. And so then you've got to deal with that. So you need to know why that liver is out of balance, and GGT is the marker for that. So next time you get your blood work done, check your GGT. Hey, Kelly there in Ohio, good to see you. All right, the next things that you want to look for, and this is going to go against what a lot of you nurses out there are watching, what your doctor's recommending. You need to do a non-fasting insulin and glucose. So tell me, how many of you guys have done fasting blood work over the years. That's pretty much it, right? Well, come in fasting. Oh my gosh, I'm so hungry. I got to go get this blood draw. We have our patients eat. We see people between 10 and 3 for our blood draws and say, go eat breakfast, go eat lunch, whatever you want to do. We just want to see it in the real world. There's a bunch of thumbs coming in. Pretty much everybody does that. If a nurse comes in as a patient, they kind of give me the funny eye, like, why are you doing this? Hey, Lori, great to see you. Long time no see. So here we are, is non-fasting insulin and glucose, because I want to see it real world. I want to see, yeah, hey Michelle, good to see you there, and yep, before you, that's all you did. But I want to see it because here's what happened. If you're fasting for 12 hours, you're going to cover up a lot of what we see throughout the day. Your glucose might be okay, your insulin might be okay, but what happens if you're doing this throughout the day and we're testing you after a meal, before a meal, whatever, I'll see glucose down at 60. I'll see insulin up at 120, extreme numbers that would have been hidden if somebody was only testing it fasting. So we've got to do that non-fasting insulin and glucose. It can tell us about insulin resistance. It can tell us a lot of different things. You need to do that non-fasting. And the last one that you want to request is your CRP, your C-reactive protein. This tells us about inflammation. Inflammation, a lot of different places. On our exams, I squeeze people's knuckles. Everybody take your hands like this, and don't just bend your finger down like this, but kind of push in a little bit at this. Here, I'll do it this one here. Kind of do it at this angle here, and tell me if anybody feels pain when they do that, and give it a good little push in there. For me, it just feels like I'm stretching. Any of my patients out there, you remember we did this during your exam, and so that's a great way to just see if you've got general inflammation in your body. Even if you buck hay bales every day, you shouldn't have painful knuckles. There's usually some other inflammatory process going. So C-reactive protein, it tells us a lot about potential cardiovascular disease. The American Heart Association says anything over 3.0, very high risk for future cardiovascular disease. Does that mean you're going to keel over? No. Does that mean you've got inflammation? Absolutely. Second thing we're going to see is potential autoimmune. If somebody's got lupus, rheumatoid arthritis, some of those different conditions, we'll see a high C-reactive protein. I had a lady today, she's full-blown diabetic. Hers was up over 9, and we don't want it over 1. And so she is full of inflammation. She's probably going to lose 100 pounds as we start working through her body and get her life back. We'll see these numbers change dramatically as people lose weight, they feel better, and their bodies really start changing. So C-reactive protein is a crucial marker, not just to see it once, but to see it down the road too, that you want to see that going down and down and down. So here's the deal. 4 main tests that you need to be doing today to get the best information you can. You don't just need a CBC, you don't just need a CMP, you don't just need your cholesterol. That's not going to tell us a whole lot. What you need is you need ferritin. You need to see if it's too high or too low. Both of those are important, and that range is a lot more narrowed. You need to see GGT. This is your fatty liver marker. Do you have fatty liver, or do you just have liver issues? You need to see non-fasting insulin and glucose, and then you need to see C-reactive protein. So do those, check them out. If you've got questions, shoot me over a message. I'll let you know what we're looking at with that. But otherwise, you guys are doing awesome. Keep working on your health, keep taking what you're taking as far as vitamin D and all the things to keep your immune system strong, and just stay good with your eating and blood sugar and all those things that we've been talking about, and your bodies are going to be vibrant and healthy. So I'm here to support you whatever way we can. If you need more support than even what you're getting on these, give any one of our offices a call. We would love to see you guys. So take care, make it a great day, and stay strong, everybody.